Wonderful. Hi, everyone. Thank you so much for coming to this Q&A today. I am Deanna Bryan. I'm the program manager at Hope for HIE. I'm honored to be here with Dr. Monica Lemmon. She's a pediatric neurologist at Duke Health, and she has been instrumental in joining us in these Q&As in the past, so she might be a familiar face to you all. It is NICU Awareness Month, as many of you may know, and Dr. Lemmon has dedicated her career to supporting children with neurological conditions and their families, and we're so happy that she's here to share her expertise on navigating the transition from the NICU to home. And we know that this transition can be very overwhelming, an emotional time for families, both moments of excitement and relief, but that also comes with a lot of uncertainty about what comes next. So she's going to help us kind of explore what parents can expect, how to recognize and respond to some of the common concerns, and then ways just to feel a little bit more supported as you take those first steps into life after the NICU. So thank you so much, Dr. Lemmon, for being here with us today, as always.
It is my absolute pleasure.
I would love if you could maybe just give a little bit more thorough explanation of who you are, an overview of your professional career, and then, of course, your connection to Hope for HIE.
Yeah, of course. Well, thank you all for joining. It is just always a privilege to get to join these events, and I am so grateful for all that Hope for HIE does for our community. My name's Monica Lemmon. I'm a child neurologist at Duke. I had the good fortune of training in medical school at Harvard and subsequently did my residency and a fellowship in neonatal neurosciences at Johns Hopkins, where I got to learn from others about many of the complex conditions that can arise in the first weeks of life. And that has included a deep love of caring for families who are impacted by HIE. I, in addition to my clinical practice, do research, and my research portfolio is primarily around how we talk about hard things, how we support families as they're going through the NICU experience and life after the NICU. And so this topic is really near and dear to my heart, but I'll give the big disclosure that I actually think the experts about transition from the NICU to home are parents themselves. And so for folks who might be listening, please feel free to share your own experiences and correct me when I share something that doesn't feel like it resonates with what you experienced, because really, truly, your experience is what I see as really the expertise in this area.
Oh, absolutely. And, to piggyback off of that too, any questions, obviously this is a Q&A, so any questions that you may have that you want to be explored or we can save to the end of this Q&A, please put those in the comments. But in the meantime, we are going to kind of transition into the discharge process itself, the first step of leaving the NICU, going to home. So what steps are typically involved or are typically part of a NICU discharge? And this can go from medical clearances to parent education before that baby actually goes home.
Yeah, really excellent question. And I'll say we're focused on the NICU to home transition, but the reality is a NICU stay really is comprised of lots of different transitions. You might have a transition from the intensive care unit to a step-down unit, for example, or to the regular floor or to the newborn nursery. And so I want to honor that those types of transitions can all be an adjustment and might mean that you're interacting with a new team or you're adjusting to kind of a new normal in terms of level of intensity of monitoring. When I think about discharge planning, I actually think the process begins at the time of admission. You're already, hopefully your team is already starting to think about what needs to happen before your baby's ready to go home. And often that might include things like making sure that your baby's temperature is maintained without needing to be under a warmer, that the heart rate and the breathing are stable and don't need extra things that you can't provide at home. It might mean preparing with equipment that you are going to take with you home, but giving your baby time to adjust to that equipment and also training you in how to use it and how to troubleshoot when things aren't going as planned. So part of the kind of transition experience will include a series of assessments that the healthcare team is undergoing to make sure that your baby is safe to be at home. Just as important, and I might argue more important, the team will be hopefully preparing you to take over much of the care that's happening in the hospital. And importantly, that can begin really early in the hospital stay. And the earlier that you're able to start doing things for your baby that you are excited to do and might be able to do at home, the better. And your bedside nurse and other members of your care team can help sort out what's possible to participate in and what isn't quite yet possible to participate in, but that really can start at the beginning. And so as you get really close to discharge, there should be a lot of education. If you're going home with equipment, often you will be asked to demonstrate your ability to do certain things with that equipment prior to going home. They might put your baby in a car seat and make sure that goes okay and that it's safe. And all of these things are really in service of making sure everybody feels really confident, especially you as the parent, in transitioning to care at home. And while a lot of that can seem like a long checklist and a lot of stuff to do, I hope that that brings comfort. That really, prior to going home, the healthcare team is trying to think really hard about the elements that would make it safe to do so in the health.
Yeah. And I know there are so many members of the care team that can assist with this too. You know, I know there are social workers too. There are child life specialists. There's a bunch of people there to support you. I know that much I know. What are, in your professional opinion, things that you observed? What are some of the biggest changes parents may have articulated to you in the past when moving from the highly monitored NICU setting now to a home setting?
Yeah. So I'll say again, this is a place where parents are the experts. What many expert parents have shared with me is that this can be a time of a big mix of emotions. There can be relief and joy, and also fear and anxiety associated with, just as you said, Deanna, going from a very monitored experience to one that is less monitored. Yes. And that can be a really big adjustment. And I want to just name and normalize. It's okay to feel all of that. It's okay to feel excited. And it's also okay to feel worried. Or to even feel like there are parts of being in the hospital that you miss, that care team member who was a lifeline for you, that person who was a big source of support. That can sometimes feel like a relationship loss as you're transitioning home and you're having more autonomy over your child's day-to-day. And so the biggest thing to normalize is it's okay to feel a mix of emotions, and it's actually quite normal. And trying to think about that a little bit ahead of time, and to know that that might be a period of time where giving yourself a little a permission to feel all of those emotions is absolutely appropriate and okay. And the other thing I'll add is that, you know, all of us, when we are suddenly the ones responsible for determining if something is normal or abnormal, that's a really hard thing to do. And so I want to also normalize that, especially as you get close to going home, trying to spend some time thinking about your baby's patterns, their movements, their sleeping, their breathing, and actually using the opportunity in the NICU to ask about that. Like, oh, is that normal? Is that, should that have worried me? Those types of questions in the NICU, when you have access to more folks, can be really, really nice. And I think we'll talk a lot about what to do after you leave. And so I think we'll probably get to that. But just to kind of normalize, it's okay to feel a lot of emotions when you get home. And in fact, most of the families we have the pleasure of working with find that period to be really tricky.
Oh, absolutely. And what are some things that parents should keep in mind about their baby's neurological and developmental health in those first few weeks at home? I know that's a really big question that comes up a lot in our new to HIE subgroup.
Absolutely. So I'll start by saying that I think about getting to know your child's development very much as a long journey. And it can often feel, especially when you're just getting home, important to think about every movement or every small element of your child's progress as crucial for their long-term health and well-being. And I want to make sure that to say that it is wonderful to track how your child's doing. And absolutely, we use that information in clinic. It is also okay to spend the first few weeks just kind of getting a lay of the land, getting to know your baby's normal, and to try to transition away from this idea of milestones to one of progress in inch stones, where what we are going for in those first few weeks is that you have something new to brag about when we ask about how your child's doing. And that might not be a developmental leap. That might be an inch stone, which is a term that the Hope for HIE community taught me.
We love it.
About progress, something your baby can do today that they couldn't do a couple of weeks ago. Those kinds of things are really important to us. And I think we'll talk about kind of red flag issues in a moment. But I'll start by saying I see those first couple weeks as a time to get to know your baby and get to know how they move, how they sleep, what their level of interactivity looks like with you, and to use that as a way to kind of build as you're trying to understand what is typical development or what might be your child's typical developmental trajectory.
Right. That's wonderful advice. Thank you. And I know this happens to everyone. When things go wrong, they go wrong at night. They go wrong on weekends. They go wrong on holidays. They go wrong when there's like severe weather. Things are closed. Offices are closed. So what are some ways that families can elevate concerns that they see as they transition home? And part of that question is also what should be provided to families as they're discharged to help facilitate that effective communication?
Thank you for that question. You are absolutely right. Everything really tricky. It never happens from 9 to 5. It just doesn't. It just doesn't. And so what that means is that it's our job as a healthcare team to help provide you with the information you need to equip you to handle questions that come up. And sometimes healthcare teams might forget to go over that type of information. And so what I encourage families to do is while you're in the NICU, ask questions like, when we get home and I'm worried about this, who should I call? What happens if it's a weekend? What should I ask my pediatrician? And what might be more appropriate for? And then add maybe a specialist that your child's seeing, or perhaps you're going home in the context of a NICU follow-up clinic. How and when should I escalate concerns? What I will also just normalize is it can feel really heavy to be the person who's trying to decide, is this typical or is this something really scary? And if you're asking that question, I would absolutely encourage you to elevate it. However, either you've been instructed to, or if you need to get emergency help, that's okay. It is our responsibility to help titrate that worry alongside you. And so if you're worried, I'm probably worried. And that might mean that in the end, it turns out it was something that was part of your baby's typical patterns. But as you're getting to know that, it is okay and actually expected to escalate concerns. And so what I always try to tell families is I would rather receive 100 videos of a child doing a funny movement, even if only one of those was something of concern, I'd rather see all 100 than miss that one.
Right.
And so what that means, I hope that's an invitation, that's permission to know that if you're worried, the healthcare team probably is too. And so it's okay to escalate that.
That's exactly what I was going to say in response to your response. That just hearing, I think that permission just alleviates a lot of, we're concerned for our babies, but we also, there's that fear of being burdensome too, and the boundary that's being crossed. At the end of the day, I think, in my experience too, I'm like, well, I'm going to get over that and I'm going to call anyway, but I just think hearing that permission is very helpful for parents. So thank you. We are now going to, since we've covered the basics of transitioning home, I'd love to shift to some of the concerns that parents may notice in those early weeks and kind of expand upon that. So what are some of the common neurologic or developmental concerns that families might notice after a NICU discharge? And then more specifically, what warning signs should really prompt parents to call their doctor right away?
Yeah. So I'll talk about some common ones. I invite people to ask questions about others that we don't cover. One of the most common ones we hear about is, my baby's doing a funny movement. Could it be a seizure?
Right.
And that is one of the hardest ones often for us to figure out just by looking at a baby. Mm-hmm. And so I'll start by giving a few broad principles and talking about some warning signs. But really the take home again is, if you're worried, I'm worried. Mm-hmm. And often looking at something alone isn't enough for us to know for sure if it might be something to worry about. And so sometimes that means that we do other tests like EEGs, which many, where we look at the brain waves and try to understand if a movement is concerning or not. Mm-hmm. So babies do all kinds of funny stuff. We also know that seizures in babies and young children look different than seizures do in adults. And so it's pretty uncommon, actually, that a baby might have full body shaking in the same way that an adult having a seizure might. Instead, a baby might have single rhythmic movements of one limb, or eye movements where their eyes move in one direction and get stuck, or full body stiffening, or even funny movements like bicycling their legs. And one way to help understand how worried you might need to be is to try to understand, is it a movement that I can stop, that I can distract out of, or is it something that's going on no matter what? And in general, now this isn't a hard and fast rule, but in general, if you can stop it, it is a lot less likely to be seizure than something that you cannot stop. The big caveat to that is often these movements are so brief, it's impossible to tell if you could actually stop it or not. But when families come to me and they say, well, I'm not sure if I can stop it. I'm saying her name, but she doesn't know her name yet. Right. And so they often ask, what are some tips or tricks? And one that I often use is actually blowing in the face. It's not painful, but it's pretty surprising. And if that immediately sort of the movement stops, I'm a lot less worried that that's a seizure than if it continues. But the reality is that test rarely works because these movements are really fast. And so what we encourage families to do is watch their baby. Take a look at their breathing. Make sure you don't see anything that makes you worried. They've stopped breathing or they're not getting oxygen. Keep things out of their mouth. Take a look at a clock and kind of keep your wits about you to try to see how long the episode's happening. I always joke when I say that because, I've seen a lot of seizures in my day and my heart rate still gets really high. They're really hard to watch. And so do your best to keep your baby safe. Try to take a look at a clock. If the baby is safe and you're really not sure it's kind of coming and going, a video can be really helpful to help the neurologist take a look at what that might be. And most importantly, call for help if you need it. If you are worried and you're worried that what's happening might be a seizure, that is a really important time to, if the episode's still happening or you have any concerns about breathing, call 911. If the movement was really brief, your baby's otherwise interacting normally, that might be a situation where you take a video and you call your neurologist and say, can you look at this today? One really important type of seizure that everyone should be aware of is infantile spasms.
Right.
These are a very specific type of seizure. Hope for HIE has beautiful materials around this, and these are sudden, repetitive movements. They might be crunching forward, quick head drop or head bobbing that tend to come in clusters, but they're very, very brief. And afterwards, children might be irritable or cry. If you see anything in that group of movements, we see that as something that needs to be treated right away, because we know that the sooner we start treatment, the better developmental outcomes that children have. And so that's a situation. If you're listening to this and you're like, I wonder if my baby might be having those kinds of movements, I would encourage you to today call either your pediatrician or your pediatric neurologist if you're plugged into one, and talk to them about that movement so they can bring you into the hospital for an EEG. I'm going to stop there with seizures. And Deanna, are there other common things that would be helpful for me to talk through?
I know that seizures is one of the primary concerns, 100%, because I think, like you said before, it's hard for a parent to discern typical baby jerks and movements from something that may be seizure-like. So I know that that's one of the biggest ones. In terms of others, I think, we might as well go into the next question, because I think it's going to explore that anyway. How can you tell the difference between something that looks concerning but normally normal? And that goes into breathing is a big concern for parents, sleep and other movements versus something that you think needs to be evaluated.
Absolutely. So other really common things that all parents and parents with HIE have questions about might be feeding, sleeping, how the eyes are moving, how their baby's moving overall. All of those are things that you might have questions about. And this, I will start by saying, we expect in general that your child's development will continue to slowly progress over the time after they leave the hospital. We don't expect your child to go backwards in any domains. And so that might mean that we expect your child to continue and hopefully improve the amount they're able to take by mouth if they feed orally, or the amount they're able to tolerate via NG tube or G tube, depending on how they're fed. And if your child's having persistent vomiting, is not tolerating foods, is not having a normal number of wet diapers, all of those are reasons to seek medical care to make sure your child's not dehydrated, because we expect that to continue to progress. Sleep is really, really hard for all babies to get a handle on, and it might be more common that babies with HIE have trouble regulating their sleep-wake cycles. While it is not unexpected that children might have sleep regressions kind of as they proceed through development, if your child is unable to sleep and persistently irritable, those are really good reasons to seek medical care soon, because we would expect your child, even when they're having a sleep regression, that they rest throughout the day. And if they're not sleeping at night, that they are sleeping through the day. If there's ever a time you're worried your baby's too sleepy, that is also a time that we want to hear about it. If your baby's not waking up when they should to eat, that's a really good reason to call your pediatrician. If your child's only awake for a couple of minutes at a time and then seems to drift off, that's another really good reason to call your pediatrician to make sure there's nothing else going on. And then babies have all kinds of funny movements. And that is one of my great joys of being a child neurologist, is actually to see typical baby movements as babies are starting to learn how to explore the world around them. In general, we expect that baby movements kind of progress along a pathway, and that they're moving both sides in the same way, unless there's a reason you've been told that might not be the case. We don't expect to be able to see really early on if a child's right-handed or left-handed. So if you're noticing big differences, That's okay. It just might be a reason to engage with your child neurologist or your developmental specialist to talk about why that might be, and to see if there are early ways we can try to address anything that's asymmetric about the two sides. So those are a few of the types of things that we often counsel families about. And I bet there's going to be more questions in the chat, but those are some of the things that I think about.
Absolutely. And I know that you hit upon this briefly before, this idea of developmental milestones. Now, normally these typically guide expectations for babies after a typical birth. But for children with HIE, as you know, that path can and may look different. So how should parents think about milestones in this context? And when is it important to be concerned if progress seems slow? Because I know I think for every, especially new parent too, those milestones, that's like the rule book by which we go by sometimes, right? So it can cause a lot of anxiety, I think, especially if things aren't being met in the way that they think they're supposed to be.
Excellent question. As a child neurologist, what I focus on most is progress. And the scope of that progress might be really variable by child based on what's gone on in their life so far. And what we want to see is that children are continuing to make even small elements of progress in domains like movement or sounds. What would be atypical that we want you to call us about is if your child's going backwards or regressing. We would not expect that to happen for the overwhelming majority of children who are impacted by HIE. And so if you are noticing skills that your child used to have and no longer has, that's something we want to make sure you share with your healthcare team. I love the term inch stones and how as we approach talking about, for example, skills at 6 months, I hope that your healthcare team is starting with your child's baseline and what they were able to do in the last visit, and focusing on, tell me about what you've been working on in therapy. Tell me about how your child's moving their hands. I'd like to know more about how your child's engaging visually with the world. Those types of questions that are really open-ended, I hope give parents an opportunity to share their child's progress in a way that isn't just about those milestones of, major events, because I think all progress can be major and should be major as we think about tracking a child's development. And so really what we're looking at is forward movement, forward progress. And as long as, if you're not seeing that, it's important to bring it up with your healthcare team to think through, are there reasons that we need to try to investigate that, or are there more services that could help unlock your child's developmental potential that we haven't yet taken advantage of?
Absolutely. I believe we're now going to transition into follow-up appointments. So as you know, as families settle in at home, follow-up appointments quickly become a huge part of their journey. So what types of follow-up appointments and with what specialists are most common and or most important for those NICU graduates?
Many institutions have a NICU follow-up clinic, and within that clinic, you might actually see a number of embedded specialists. And so I'll name some of those folks, but just know that at some institutions, that might not be housed in a single clinic, and instead you might have a series of appointments. In our clinic, there is a pediatrician who specializes in development. There is a physical therapist. There is access to an occupational therapist and a speech therapist who might be helping at early ages with things like feeding. There is access to a social worker who can help navigate some making sure that your child's getting what they need and they have access to those things. And we have a nurse coordinator who can help kind of field questions as they come up and hopefully help triage questions around, is it time for me to go to the emergency department, or is this something we can handle with my pediatrician, for example? Many children will also have a child neurologist, and depending on the clinic, how often you see each of those people might vary. And some of those appointments might be collaborative, and other institutions might choose to stagger them. And so you have a pretty big comprehensive team. In many states, access to early intervention, so physical therapy, for example, can occur in the home. And so you might have folks who are coming to your home who are able to support especially physical therapy early in life, and later in life occupational therapy and speech therapy as those needs become more clear. And the cadence of that will vary depending on your child's needs and what availability looks like in your community. The other thing I'll just say is that, we see folks even if you're seeing a physical therapist once a week, the reality is the real physical therapist in that home is you, because you're being given the really important exercises to do in between those visits. And the therapy is happening in a holistic way that's integrated with your life, and is likely happening on a day by day, hour by hour basis, not just in those isolated visits. And so you are an incredibly, probably definitely the most important member of that care team. And some of these other professionals are there to hopefully bolster your expertise and make sure that you're getting the guidance you need to deliver the early intervention.
Absolutely. And how can families best prepare for these visits to make the most of their time with specialists? I know that time goes by quick, and they feel like there's a lot to cover. So any recommendations, even it's from like keeping a journal or a log of symptoms, anything that you have witnessed being especially helpful for families would be wonderful.
Absolutely. So I, seek medical care with my children, and I'll say, I'll have all these things I want to ask. And then I get in the room and I can't remember anything. This might not happen to you, but this happens to me. And if that might happen to you, especially in amidst a busy visit, I really do encourage folks to write down questions, have a place where you organize information. I'll say that, the level of detail can vary by your comfort level. Even really high level details of like, here are my 3 most important questions. Here's a few concerns that I've raised. Can be really helpful. And so really that tool is the most important part, is that you have access to it and that it's written in a way that jogs your memory and that helps you feel empowered. It is also always okay to share those materials with your healthcare team member, or to even share them in advance if that is a care model that works well for you. There are times where a family might send, here are 3 questions I want to cover in our visit. And then the clinician has time to prepare and make sure that they've thought it through and isn't answering that on the fly. That's absolutely okay and appropriate, depending on your provider's preferred communication. And that's something I would really encourage folks to actually have an open conversation about. How, what can I share with you that'll help this be a productive visit? And it's also okay to do some goal setting. Hopefully physicians and other providers are asking, what are your goals for today's visit? If they don't, I might offer, it's okay to say, I have 3 big things that I want to make sure we talk through. Here they are, to make sure that those get addressed in the visit.
Wonderful. And now that we're talking about questions and preparing, sometimes parents don't know or aren't sure what to ask in those early follow-ups. So from your perspective, what are some of those most important questions families should bring to their care team?
I love that question. I'll put in a little plug here. The Neonatal Seizure Registry has developed some question prompt lists that can help give you some ideas about questions to ask. I think really important ones might be, in between visits, if I'm worried about something, who should I call? That's a really important one. Or, I'm worried about X. A question I think folks often forget to ask is revisiting information from the NICU stay that they don't feel quite clear about, because that was a really chaotic time. And so it might be, we spoke with people early on about the MRI findings, but I'm still trying to sort through what this all means for my baby. Can we go over it again? It is okay to ask those. Other questions might be, what can I do to support my baby's development at home? Are there therapies or other early interventions that we don't have on board that we should think about? Those are all, I think, excellent questions. But the most important thing is that your questions are likely to be really individualized.
Yeah.
And so writing them down and feeling empowered to ask them is truly not just welcomed, it really helps, I think, the visit be most productive. And so I hope that any physicians or other providers that you're working with are sort of actively asking for those. Even if they don't, it is expected and really encouraged to come with your high priority questions to try to make sure they get answered.
Absolutely. And then another facet of that is ensuring that parents understand the baby's care plan, especially if multiple specialists are involved. So how can medical providers help facilitate this understanding of, of this case?
This is really, really important. And I'll say that I wish that we had kind of one joint care plan for every child with every health condition. I would be dishonest if I said that at our institution, we've been able to implement that for every child. It's hard to, these can be hard to develop, but importantly, having some type of written guide for the key issues that your child is dealing with can be really helpful, not just for your, what I'll call your primary care team, the care team at the institution where you usually seek care, but in the unlikely event your child needs to seek care on a weekend, when you're on that vacation, making sure you have a way to transfer information is really important. We're fortunate in 2025 that it's easier to see records at other institutions than it used to be, but it's still not perfect. And so having a written summary of your child's main issues, certainly medications and doses, and any emergency plans that might be relevant to your child is really important to have for yourself. For any people who are taking care of your child outside of when you do, this might be a daycare, for example, or with a babysitter or a trusted family member. And keeping that on you in a way that you can access it easily should you need to seek emergency care is really important too. And so for some babies, that might be a seizure action plan. What to do if they have a seizure. For other babies, it might be something about breathing or oxygen if they get sick, or if or how to manage different equipment that they have at home. Those are the types of things that can be really important to make sure that you have written. And if possible, I would really encourage folks to make sure there's a contact for each element of that care plan. So making sure that you understand how to contact the neurology team on call, the developmental team on call, whoever helps manage your child's, for example, feeding, or if your child has extra respiratory support, making sure you've got a contact for each of those teams so that you can have easy access to it.
Wonderful. And we always love to end our Q&As with recommended resources. So we know navigating this transition can be hard, maybe a little isolating for some people. The whole goal is to make them know that they're not alone in this. And part of that, it comes with resources, whether it's medical, educational, or community-based. Which ones would you recommend for families to help them feel more supported and confident as they continue to care for their child at home?
Absolutely. So I'll start by saying every institution might have individualized resources, and those can be incredibly helpful. Importantly, it's worth asking. before discharge, what resources do you recommend for support, for parent support, for peer support in our local community? Because it's possible that your institution has a peer support community that's local. And many do, and that's really important to know about. We know that many institutions don't have that, and I couldn't possibly come on to this Q&A and not celebrate Hope for HIE's resources. And there are, as you, I'm sure, know, a wealth of resources on the website and in other places that are all vetted thoroughly by members of the Medical Advisory Board. Mm-hmm. And I think are really parent-centered. And I just, it's such a gift to our patients that they exist. There are lots of other organizations that have developed resources, many of which might not be specific to HIE, but might give you information about a topic that is relevant to you. A resource that I share with people often, Courageous Parents Network created something called NeuroJourney, and that outlines sort of longer term multi-system resources for children and families who are impacted by neurologic illness of all different types that I find can be really helpful. And of course, there are many other NICU-oriented organizations. But for folks who are seeking support in this community, I just want to say that I find the resources offered by this community to just be remarkable. And incredibly informative. And they also have access to a medical advisory board to help guide some of those. So I think we can safely say that they're vetted and accurate.
Wonderful. Thank you. Thank you so much for sharing your time and expertise today. I know you've helped us many times in the past too. We know that this is such a significant step for families to go from the NICU to home. So I know that your insights are going to help a lot of families make that journey feel a little less overwhelming and a lot more supported. So for everyone tuning in, just know you're not alone. We're here to walk alongside you. We have medical advisory board members who are well equipped to help as well. So I just want to close out this conversation that, during NICU Awareness Month, just a quick note, we honor the strength, we honor the resilience and love that carry families through this chapter and beyond. So thank you again, Dr. Lemmon, for joining us. And I'm sure we'll see you again another time for another session. But in the meantime, if there are any questions that come through that you don't feel like we answered today, this will be posted on YouTube. We're going to have key takeaways on our blog as well. But feel free to reach out and email a member of our team. You can email me. You can also post comments, and we will make sure that we forward them to Dr. Lemmon, and we can help you feel supported as well. So thank you again. And
thank you.
Oh, wonderful. And thanks everyone for joining, and we'll see you next time.